Hello friends, today's video I will discuss about the CTV congenital talipes equinocaevovirus deformity is also known as the clubfoot. So clubfoot, the foot of the child looks like a hockey stick. Okay, so CTV means congenital talipes equinocaevovirus deformity. Congenital means the things which are present since birth, so is known as the congenital. T for talipes. Talipes, in case of the untreated clubfoot cases, child started walking with the foot like this, okay, on the outer part of the sole. So child put the weight on the talus bone. So it is known as the talipes. Okay. E for equinus. Equinus is synonymous with the horse. Okay. So the child is not able to lift the foot upside direction. So this is the equinus deformity. V for caevovirus. Caevovirus means this is like a cave. Is like a cave, and the varus means the foot is twisted inside. So this is the congenital talipes equinocaevovirus deformity. The majority of the parents ask me why it happened to my child. Is there any relation to the eclipse, moon eclipse, sun eclipse? No, it is not like this. If it is, then we don't know as an allopathic doctor. If it is, then only our ancestor can tell us. But as a present, we can't support eclipse in relation with the clubfoot. Sometimes some says there's a pressure inside the mother womb that causes the compression of the foot and leading to the clubfoot deformity. But majority of the Indian females has IUGR, intrauterine growth retardation, low water level in the mother womb. So it is not that common. The incidence of the clubfoot is very rare, like 1 to 2 children per 1000 live birth. So it is not that common. Okay, so majority of the parents ask me, so then what is the reason? We divide the clubfoot into two parts. One is the idiopathic clubfoot. Idiopathic means there is no reason behind it. Nobody can tell you the exact cause of the reason, and the majority of the cases fall in the idiopathic cases. And the 90 to 95% clubfoot are fall into the category of idiopathic clubfoot. And the second category is the secondary. Secondary involve the reason behind the clubfoot, like neuropathic clubfoot. If some nerves from the brain compress near the spine level, like a meningomyelocele, spina bifida, or any spinal tumor, or any kind of the nerve stretching like tether cord syndrome, may leading to the muscle weakness or a clubfoot deformity. Second is the syndromic, any syndrome related to the clubfoot or any kind of trauma, infection, or other reason leading to the clubfoot deformity. So majority of the cases are falls in the idiopathic clubfoot, as I told you. So treatment is very simple. We started with the plaster, 4 to 5 plaster on weekly interval, followed by the tenotomy. So parents ask me, why you apply POP plaster, plaster of Paris? Now the many lightweight plasters are available in the market. Why you are using this heavy POP plaster? So POP is having a very good quality of the molding. If you have seen, majority of the idol of the god and goddess are made up of the plaster of Paris, because we have to make the nose, ears, and the other part of the body according to the shape of the god and goddess. So basically, so we have to correct the foot, and we have to stretch the foot, and we have to mold the foot according to the stretchability of the muscles. So that's why we put the POP plaster. And the second reason behind the putting the POP plaster is that you can remove the plaster at your home. It's very easy procedure. No need to use any machine, scissors, knife, nothing. You can put the plaster in the lukewarm water, and you can unwrap it like a roll. And this third reason, you involve in the treatment and you feel better. And second question parents ask me, why you put the plaster up to the thigh level? Because the deformity is in the foot. You can put the plaster below knee. Why you are applying the plaster above the knee and up to the groin area? So reason behind applying the plaster up to the groin area is, so one, the chances of the slippage, okay, because the child usually kick the leg, and the things which are up to here is easy to slip, and things which are up to the above the knee will be difficult to slip, because there will be a two junction in the plaster. Okay, so to avoid the slippage of the plaster, it is necessary to put the plaster above the knee. And second reason behind the application of the plaster above the knee is the muscle. The muscle which is known as the gastrocsoleus muscle or tendo-Achilles tendon, which is attached above the knee and up to the heel area. Okay, so we always try to stretch the tendo-Achilles in the plaster to avoid the surgery. That's why we use the plaster up to the above knee. And third reason, to stretch the knee outside, because the one problem which is known as the tibial intorsion is also involved in the clubfoot deformity. So to correct the tibial intorsion, we use the stretching outside direction, and which is possible only in the plaster above knee there. And the parents ask me, when can we start the treatment? What is the ideal time of to start the treatment? So basically the treatment should be started as soon as possible. Even you can start the treatment from the day one of life. Okay, sooner is a better. Early treatment give you a better result, and there are three reasons behind the early treatment to promote. One, the child muscles and bones are very soft. You can easily stretch them. Okay, and majority of the children, they sleep 16-18 hours in a day during the early of life. So the usually the pain percentage is come as compared to older children. And the second reason why we do the early plaster, usually the clubfoot, suppose this is my left side is the clubfoot and the right side is the normal foot, and the clubfoot side is usually smaller than the other side. The simple reason, suppose my foot is like this, the bone, the inner part of the foot, so this is the bone, foot is like this, the inner part of the foot bone is not developed until you stretch and give the space to the bone. So early stretching and early correction will give you a better size of the foot. So that's why we usually promote early treatment. Usually the duration of the plaster is 5 days minimum and 15 days maximum. Usually we change the plaster in weekly interval. 4 to 5 plasters are given, and after that we do the tenotomy. Tenotomy is a very simple procedure which loosen the tendon. In one of my video, I have explained how to do the tenotomy. It is a very simple procedure. Hardly a 1 or 2 mm cut is there, in which we loosen the muscle from the heel area, and then leading to the dorsiflexion of the foot joint. There is no harm of this surgery. The tendon we usually cut double up by itself, because child has a very good regeneration power. Regeneration means the things they make by themselves. Okay, because they are the growing children, the tissues are developing day by day. So the tendon which we usually cut, it redevelop or regenerate by itself in a month of 2 or 3. Okay, so there is no harm of this muscle, there is no limping in future, no weakness in the muscle. Physiologically, anatomically, structurally, power and strength, everything will remain same, and there is no harm basically. So don't worry about the tenotomy. Most of the parents like afraid of the tenotomy. This is the tenotomy, and then there's such a small children, how I can say yes for the tenotomy? So don't worry, friend, this is a very simple procedure. It can be done in the local anesthesia, completely safe and good for the child. And after the tenotomy, we put the child on the plaster for 3 weeks, and after that we remove the plaster, we give the braces. Braces are very simple. We usually put the foot in a 60 to 70 degree on the right side, means the clubfoot side, and the 20 to 30 degree on the normal side. So we put the braces. Majority of the parents ask me, if I have a unilateral clubfoot or a one side clubfoot, why you are applying braces on the both foot side? So the reason behind the putting the braces on the both side is, suppose my foot is like this, I have corrected the foot, and now the foot is like this. So now you have a 3 option. One, the duty of the one person is for putting the foot like this for 24 hours, 365 days, which is practically impossible. And what I can do, second option is, I can put the child on the plaster for 365 days and 24 hours. No, not possible. So what I can do, I can ask this foot to push on this side, and I ask this foot to push this other foot on other side, and I can put the bar in between. Okay, and because of this, the child can keep the foot in a proper direction. So these braces to be used 23 hours in a day for 4 to 5 months or 9 months of age, whichever is higher, and after that night time or nap time till 5 years of age. Once the parents listen, 5 years, 5 years is a very long time. Why so long time? So basically, the purpose of the putting the braces for the 5 years is to avoid the relapse. Okay, suppose my foot is like this, so my foot will grow in this direction. Okay, so to avoid the chances of the relapse, we have to use the braces for the 23 hours a day for 5 months, and after that night time or nap time till 5 years of age. So friends, don't worry, clubfoot is 100% correctable. Don't worry, don't hesitate, get it treated in nearby your hospital or come to me. It is completely curable. Best of luck. Thank you.